Jess.
Thank you. Hi, my name is Jessie Willis. I'm a fourth year medical student at the University of Ottawa. I'd like to give a quick thank you before I begin to one of my author's mothers who lent me this shirt because the airline forgot my luggage or lost my luggage. So it's okay now, but on to my presentation. My project is titled Online Training in Scholarly Peer Review, a Systematic Review, and I have no conflicts of interest to declare. So a bit of background before I begin. So in 2018, Publons released their Global Reviewer Survey in which they asked how important is peer review training for ensuring high quality peer review? And 88% of their almost 14,000 respondents said that peer review training was either extremely important or important. However, when asked how many of them had actually received training, 40% indicated they had no training whatsoever, and many of them had indicated they had only received informal training such as self-selected reading material. So our study was a systematic review of all online openly available training and peer review. So we did both literature search, database search using a peer-reviewed search strategy by a medical librarian, as well as supplementary searches of preprint servers, Google, YouTube, publisher websites. We took the top 6 publishers by journal count, as well as any publishers that had indicated a specific interest in peer review, as well as university library websites, so the top 10 universities in each geographical region, as well as the top 15 universities in Canada, as our group is from Canada. Go Canada. And any peer review related events and groups, so such as the Peer Review Congress itself. And yes, I did organize everything in color order because I'm like that. So our inclusion criteria were any educational material intended for biomedical manuscript peer reviewers, openly accessible online of the day of the search. We used an an earliest cutoff limit of 2012, and this was based on the year that Publons was launched. This was due to the fact that Publons created the first, to the author's knowledge, openly available online training and peer review. Exclusion criteria, so we excluded anything for any other types of peer review, such as grant review, opinion-based publications like editorials or commentary pieces, having a barrier to access, and language other than English or French, because this is what the authors of the paper spoke. I will speak about the barriers on the next slide. So this is our Prisma flowchart of our included studies. So as you can see in the top left, the amount identified by the searches, and then we had 1,200 studies at the title and abstract stage, and then 233 at full text. In total, then we identified 45 documents that were training and peer review. However, over 50% of them had some form of barrier to access, and we thought it would be important to quantify these. So on the screen, you can see a table. The most common barrier to access was being available for only a limited period of time, so being a reoccurring event, for example. Having a membership requirement, so being a student or a staff at a university, us not having access to the training based on our university access, or being a member of a society. Another important barrier was having a paywall. So the average paywall amount was $99 USD. So in total, included in our data analysis, we had 22 studies. So in result, unfortunately, for quite a few of the studies, there was no reported author information, funding disclosures, or year of creation. But for those that did report a publication year, the majority of them were created after 2017. 50% were created by journal publishers, and just under a quarter were created by universities and colleges. And the United States created the most training, followed by United Kingdom and then Germany, and unfortunately none by Canada, even though we gave them a little bit of help. So for time to completion, a good chunk, so 68% of the studies took only an hour to complete or under an hour to complete. So one could think that maybe that isn't enough time to cover all aspects of peer review. Our target audience, so interestingly, just over a quarter of the studies were for journal reviewers at the specific journal that developed the training. The most common training formats were online modules or webinars, and just under a quarter provided some form of certification to completion. One had a certificate if you paid for it. So we took a look, we wanted to look at what topics were most commonly covered. So we did a content analysis using predefined areas of interest. So we looked at peer review guidelines and checklists provided by journals to create these areas. And covered by 91%. So the most commonly covered was how to actually create a peer review report. And then going from to the left of that are more things that have to do with the peer review process themselves. So how to become a peer reviewer, the definition of peer review, and the different types of peer review. Then moving to the right, actually going into how to critically appraise a study. So most did cover how to critically appraise data and results and methods. And then less commonly covered were reporting guidelines, academic writing, clinical trials, and statistics. So we wanted to do a risk of bias assessment. Unfortunately, from our knowledge, there isn't a risk of bias tool for training. So we created our own tool using a previous study that looked at a checklist for predatory journals. So we had 6 items on our risk of bias assessment, and a document was considered evidence-based if it met 4 out of 6 of those. So just briefly, these were having greater than 1 stakeholder group represented in the authors. These all make you low risk of bias. Reporting data gathering prior to creating the training, pilot testing the training, learning objectives, having a set of learning objectives for the user, having a self-testing or evaluation method for the user, and having a feedback method such as a survey at the end. So only 4 training documents met the criteria, so 4 out of 6 as evidence-based. Interestingly, 3 out of 4 of these were the ones that took the longest to complete. So the 2 of them took 4 to 8 hours to complete. 1 of them took 2 to 4 hours to complete. So in conclusion, our study identified 22 openly accessible peer review training documents, of which only 4 were evaluated as evidence-based. Peer review training is desired and yet seemingly undersupplied, and only a small number of training opportunities seem to exist. And this is consistent with other studies as well as the reviewer survey, which I mentioned at the start. It's also consistent with another study that we are planning to publish, which is a sister study to this one, which is a survey of peer reviewers similar to the Publons Global Peer Review Survey, but specifically focusing on training. And that's actually being presented in the poster section by Janina Ramos, one of the authors, one of my co-authors on this paper. So I encourage you to check it out because I find that these 2 studies complement each other very nicely. So I'm a medical student. I'm in my 4th year, and I'll still require 4 more years of training before I get to practice medicine. And peer reviewers require no training, and yet are a crucial part in the dissemination of the evidence-based medicine that is published and the clinical guidelines that are published. So we encourage and we implore stakeholders to focus on future efforts to create a program in peer review training. And this would meaningfully promote peer review skills and maybe in the future could be required to peer review. Thank you.
Great, thank you very, very much. Let's see, I don't see anybody at the mics yet. I'll ask a question and give people a chance to collect their questions. I didn't really have a sense of, so I have to give a talk related to peer review next week, so I have a stake in this. And were there any of these tools in particular, maybe you don't want to call them out, that at least at face value, when you looked at them, looked like they might be more effective or more fun or more effective? I mean, were they interactive? I have no sense of when I would go online if I'm just going to see a sort of a set of PowerPoint slides, or I'm going to be engaging in a lesson that actually will hold my attention and that of my trainees.
Yeah, so 2 things to that. So I was actually part of the data extraction. I verified all the data extraction that was done. So I now consider myself the most trained person in peer review, except I've never done any peer review whatsoever. So there you go. And so I can speak to all of the training, but yeah, you're right, I shouldn't call them out. Some of them, I found that the multi-based modules were very effective, and there were a few of those. You're right, it's very difficult to listen to for example, a webinar, if it's just someone speaking at you, and those were normally under an hour. I could go in forever about all of these different trainings. I think it's important as well to talk about that survey that is being presented. We also asked what people would prefer, like what do they actually want to see? Most people actually said they want something online, and then a multi-part course. So like at least six sessions. So more in line with something that would take like 4 to 6 hours or 4 to 8 hours, which is, as you can see, not represented, as most of these trainings took less than 1 hour. Hope that answered your question.
Yes, that's great. And you give people lots of reasons to catch you during the reception so you can name some of the ones you thought were
Yes,
better.
yeah.
Okay, in the back.
Hi, I'm Victoria Sagel from the Canadian Medical Association Journal. Nice to see another person from Ottawa here. Just curious, in any of the training modules that you came across, did they give guidance for other stakeholders that might be involved in peer review, such as patients, family members, or members of the public?
Yes, so we did have one study that was excluded because it was for patient peer review. We didn't want to include things that weren't specifically for peer. That was one of our exclusion criteria that I just didn't mention. But yeah, there was something there that I saw for patients, as I remember. Yeah.
Great, thank you.
Over here.
Hi, Elisa De Ranieri from Cell Press. Don't know if you can answer this question. It's more for discussion, really. But based on your experience and based on the talk that we've just heard before, what do you think would be the most impactful intervention for, for expanding reviewer pools? Is it to train them with these online tools, or to provide a mentoring program, or both? If as a publisher, what should I do to be more impactful? Which way should I go?
Yeah, it's a great question for discussion, and I think it has been mentioned previously in the other talks that there have been a few studies that look at interventions for improving peer review quality, and unfortunately, a lot of the studies, there's a few of them that I looked at when I was doing this study that showed that training wasn't effective, but those studies looked at in-person training and they were a bit old. So I'm hoping that in the future, there will be a way to evaluate this online training. I think it's important to make sure that it is effective. And I think that's also why it's important for the people taking the training to provide feedback to make sure that they liked it.
Thank you.
We'll go to Lisa, then Ariel.
Hi, Lisa Barrow, University of Colorado. And I was really struck by your content analysis that showed there was so much duplication of effort between all these different tools, and everybody's developing their own one. And did you get a sense at all that some of the trainings were specific to a journal, and that was actually needed, like did it stray into the content or clinical topic of the journal? And I guess I'm just wondering what would be those core elements, and since there's so much duplication, and was it consistent?
So for like a journal, yeah. So there were, and when I said that the target audience, I think in a quarter of them were for peer reviewers at a journal, those usually did have a section that were for actually peer reviewing at that journal. And I don't want to I don't think I remember seeing anything for like specific like areas of expertise, but some of them were more specifically tailored. There was a second part to your question, sorry.
Well, it was just that what would be the key elements in this training that you're recommending at the end?
Okay.
If there's a more universal training, since there was so much more duplication there, what would be the key elements?
Yeah, I think that the first step for developing a future training would be to develop a set of like core competencies that are agreed upon for reviewers. I think that it's difficult to evaluate training when we're still not clear, or it's still not clear what the expectations are for a peer reviewer. This has been previously done for editors, like developing a core set of competencies for editors of journals. I think it would be important first step to do that, and then we could evaluate training based on those core competencies.
We'll have Ariel and then Mario.
Thank you. It's a wonderful talk. Again, I think just before my question, I look forward to you publishing this work and letting us know what those 4 resources were so they can be utilized. Similar to the last question, one of the things that I find is that peer review is very specific to the article that you're reviewing. And so I'm curious, in your evaluation of these tools, how broad were they? Did they tend to be any type of article, or were they divided or segmented to help the reviewer learn how to specifically apply skills based on what would be appropriate for that type of article?
Yeah, and I think because a lot of the training that we had was created by publishers and universities as well, those ones were more broad. And this study is available already on preprint, so you can look me up on Twitter. I'm at Jess B. Willis, and I posted the links for the preprints of them, so you can find the study the training that met our criteria as evidence based. And without naming them, the two of them were very broad. Yeah.
Thank you. Mario.
Hi, Mario Stanford. In light of Ariel's talk, did any of these training mention any quality instrument to assess the quality of peer review? And were any providing templates for peer review?
So you're asking if the training had training on the quality, like looking at.
No, did they mention to authors how they can evaluate the quality of their own peer review? Did they mention any instruments that are used to evaluate the quality of peer review?
I mean, most of the training was for peer reviewers themselves undertaking peer reviews, not really about the quality of peer review afterwards. And we didn't look at anything more than what I posted on.
No,
the
for
site.
example, I think what he means is like, did they present like the RQI, like the structured,
Yeah.
that's something that they
Oh,
might
I
aim
see.
for?
So only one of the studies that we had actually had published an article evaluating the effectiveness of its training.
No, I meant, can a reviewer self-evaluate its review? Did they provide a tool?
Oh,
So you
yes,
can say
I
how good my
understand.
review
Okay.
is after this training?
I
No, nice.
can't comment we didn't look at that. And this is now just going based on my memory. I don't think so.
Thanks.
Hi, Jan Ole Hesselberg from the University of Oslo. We are working on a Cochrane review on training peer reviewers in both grant and journal peer review. And it's hard to be very optimistic, I think, about training. And I think maybe an issue is that the ambiguity in the task is so large, and you can interpret both the material and the criteria in many ways that will always produce noise in the assessment process. So I'd like to hear your thoughts about that. Are you optimistic?
I'm always optimistic.
And
and
just and another question, did you find any tools that both assess are used for grant and journal peer review?
No, only for, maybe one of them had like a section, but not that I remember. So to your first question, yeah, I am optimistic. And I think also because we did that survey and it showed that many people still want, and as the Publon survey says, people want training. I think I have the perspective though of an early career researcher. And to me, like before I would undertake peer review, maybe in like 5 years or something, I would want training before I felt comfortable. And I think it is indicated that a lot of early career researchers want additional guidance. But I think the first step is definitely developing clearer expectations for peer reviewers and what are core competencies for being a peer reviewer.
Thank you.
Thank you.
I think it's Steve, right, in the back?
Yeah, Steve Woloshin from Dartmouth and the Lisa Schwartz Foundation. My question is actually for the organizers of the Congress. Why don't you add and make a page on the website where you can post the kinds of educational materials you've discovered, actually in the prior speaker as well, the evaluation criteria. You know, the peer review Congress should be like the go-to place for peer review, right? So it just seems like a pretty obvious thing to do. But thank you for your interesting.
Thank you.
research.
I agree.
I think all the organizers heard you. And they're nodding with chagrin. Anna.
Thanks, Anna Marusic, Croatia. I want to ask, I know that you don't have a large N, but what were actually how the outcomes were measured? What were the outcomes? Because you have this Kirkpatrick's educational outcomes classification, whether they are happy, whether they have new knowledge or skills, whether they will change behavior, and whether they actually change behavior. So what were the outcomes of training measured?
So we did look if the training had a study published afterwards or had anything that they said afterwards where they evaluated the training, and only one of them had a study published afterwards that looked at
Yeah.
I can't speak to the specific outcomes that they used that evaluated them. So I honestly can't comment on how effective these trainings were.
So this is probably the way we should go to
Yes,
evaluate the
yeah.
effectiveness of it. Yeah, thank you.
Annette? Last question over here.
Hi, Danny Vanko, AACR. I was just thinking, how much of this training should be focused on really improving the quality of reviews, which everybody's talking about, versus getting more people involved in actively reviewing for journals? Because I think some people will just naturally be good reviewers. Some people naturally be not good reviewers, but it's hard to get these people involved in the peer review process actively at journals where editors can see them, experience their quality of review, and then use them over and over again if they are good reviewers.
And yeah, I think early career researchers and expanding the reviewer pool is really important. I know that journals do tend to struggle to find reviewers, and so that is a great point. And I do hope that training will expand that pool for them. I do also think that, for example, if a journal has to email like 30 people before they get one person to bite for reviewing, making sure that the people that they're emailing are trained and as you say, like good at peer review.